In March, inspectors with the Virginia Department of Health paid another visit to Colonial Heights Rehabilitation and Nursing Center, following up on a previous inspection that resulted in 340 pages of violation findings, which revealed excessively low staffing at the facility, inadequate wound care, and medication errors. While VDH said it expected the nursing home to come back into regulatory compliance as it said it had, the agency's revisit discovered otherwise. Here are some of the new citations. Inspectors say the nursing home failed to report an allegation of abuse in a timely manner after a resident and a nurse aide got into an argument and the staff member allegedly pushed the resident so hard that he fell off the bed. He reported it to the police, but prosecutors say no charges were filed. For another resident, the nursing home was cited for failing to ensure that he received treatments for worsening pressure ulcers. The patient claimed that nurses did not change his wound dressings and alleged that they would argue with each other to avoid doing it. But staff, including the medical director, reported the resident refused care multiple times and that they even tried obtaining a medical emergency custody order so he could go to the hospital, but it was denied. In another case, a resident sustained 2 falls, yet inspectors say the facility failed to develop and implement resident-specific interventions. The facility also documented making contact with the resident's daughter to alert her of those falls, but inspectors say they never actually made contact with her. Facility staff said they attempted to, but the phone line was disconnected. And lastly, the facility was cited for failing to maintain one-on-one supervision of a resident with mental health issues and a known history of making unwanted sexual advancements on other residents. In a statement, a spokesperson for the nursing home said these latest violations were lower level in terms of severity, and she says the facility took several steps to correct them, like resident referral for guardianship, various types of resident audits, education and re-education of staff, notifications to healthcare providers, residents being placed on one-to-one supervision, and the reporting of allegations to law enforcement. She says while Colonial Heights and many other skilled nursing facilities strive for perfection, people are human and do make mistakes. The importance is that no harm occurred, corrective action was taken, and the dedicated staff of Colonial Heights continues to work both hard and competently to provide for the health, safety, and welfare of its residents in the face of intense scrutiny. CBS 6 confirmed the federal government began fining the facility $1,300 per day starting in January and would start denying Medicare and Medicaid payments for new admissions if it did not come back into compliance within 3 months. A spokesperson says the facility has not received a notice of denial of payments for new admissions, and even so, she says it would have no impact because Colonial Heights stopped accepting new residents after most of their nursing staff were arrested. She says that was to consolidate resources and focus on care. She says it is now believed that Colonial Heights is back in substantial compliance with regulations, and they're waiting on another inspection to confirm. I'm Tyler Lane for CBS 6 News.